Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Ray Gapus, joining you for our learning and teaching session specifically for another case. This time around, we're going to label it case number 2. And without further ado, let me first knock on your kind hearts and soul. Please do join us in this mission. Our goal is to provide free NCLEX RN application and review to 100 nurses. We've done this successfully in the past 2 years. We've given our less fortunate brothers and sisters in the profession an equal opportunity to take and pass the test. And we're really, really successful in terms of this mission. So please, once again, I'm knocking on your kind hearts and souls. So please do help us achieve this goal. And there's only one thing that I ask from you, and that is to just watch and finish the ads in our videos. Thank you very much in advance for doing so. So on to our case number 2. But before that, let me share a success story of this lady, Janelle Cruz Opay, from Our Lady of Fatima University, who passed the NJN for the State Board of New York, class May 15, 2024. And here's her very inspirational journey. I'm delighted and proud to be part of the Ray Gapos review system. It was last year that I joined the review in the Philippines. Yes, you can join limitless, it's unlimited, but I decided to take some units in Canada to pursue my career as a nurse. I'm thinking that I won't be a nurse here in Canada if I can pass the NCLEX RN. So during studies at school, I also spent a lot more time reviewing with the help of my past quick fix lectures with Sir Ray and all the videos in YouTube that I watch over and over again. It was very helpful to me. So last May 15, 2024, I took the courage to take the exam, and with the help of my fervent prayer, I successfully passed NCLEX RN. My hats off to you. You deserve a round of applause for doing your best in your journey to pass the NGN. Okay, now on to our case number 2. And this is about informed consent for a child with divorced parents. Now, remember that informed consent is given by a person who has the capacity and who was given full information about the procedure, and he signed the consent form before the procedure was done. So the most important thing that you have to remember regarding informed consent when you're taking the NGN is, even if you know the concept, the general concept, remember, case studies would usually have a twist. Like in this case, it's a case of the informed consent for a child with divorced parents. Now, the primary question that you have to ask when you are faced with this situation is, who has the legal custody for the child? And to resolve that, let's begin with functional concepts. Remember, a functional concept could be a word, a phrase, a sentence, or even a paragraph that is considered as directional. It's a set of concepts that gives your mind a sense of direction on how do you deconstruct a specific question. So it's actually a preload in terms of the concepts that you need when you engage in analyzing a case study. So providing medical care to a minor should begin with determining the relationship between parents. This is what I'm trying to say a while back. It's very important that you are certain what kind of relationships does the child have in terms of the parents. So are the parents married? Or if they're not, are they separated or legally divorced? So in providing medical care to a minor, a married parent may individually and independently consent to it. The other parent's consent is not required even in significant medical conditions, which simply means in a situation where you have married parents to a minor child, one parent who accompanies the child for a procedure that requires an informed consent can individually and independently consent to it, even without the consent of the other parent. Okay. Now, marital discord could occur, and this could include conflict, disharmony, lack of agreement between currently married parents, and sometimes this would lead to one or both parents telling to one another, I don't love you anymore, I don't want to be with you anymore. So, what happens now to the minor child? Okay. And this has special implications in terms of medical care. So separated parents are not necessarily legally divorced. That's why it's very important for the healthcare professional to find out, are the parents just separated and still are married, or are they legally divorced? So separated parents who are not necessarily legally divorced are still regarded as married for purposes of determining the authority to consent and the right to access medical records of a minor child. So when parents have joint legal custody after a divorce, pay particular attention to this, both parents retain the authority to consent to medical decisions on behalf of their minor child. Remember, joint legal custody equals both parents having the authority to consent to medical decisions on behalf of a minor child. Now, when parents are divorced, the consent of both parents is required before proceeding with the treatment plan for the minor. And one thing that we have to remember is that when divorced parents disagree on providing consent for medical care or on the access to the minor's medical records, both parents must provide legal documentation outlining the rights over medical decision making for the minor child. So it cannot be just one parent telling the healthcare provider that they will only need to grant access to medical records to him or to her. That is not the proper procedure. So one parent's claim to be the sole provider of consent for a minor child should be supported by legal documentation. So it's very important for the healthcare provider to obtain a legal documentation from both parents. And this legal documentation should outline the rights over the medical decision making for their minor child. Now, obtaining documentation of authority to consent, therefore, is considered as the initial action that should guide the nurse's intervention in a situation where the divorced parents do not agree as to who should provide consent for a procedure on their child. Access to a minor's medical record is determined by which parent has the authority to consent to the child's medical care. Therefore, whoever between the two parents has the authority to consent should also be consulted in terms of access to a minor's medical record. So here's our case number 2. A 10-year-old child whose parents were divorced was brought to a clinic appointment by the mother. So pay particular attention to the fact that you have here a minor below 18 years old. So the client's father called the clinic to request for a copy of the client's medical record. Here we go. So here you have, in this case, a divorced parent, and you have here the father requesting for a copy of the minor's medical record. Now, on the other hand, the client's mother, the one who brought the minor to the clinic, who lives with the client, gave instructions to the clinic personnel that includes providing medical information only to her, as she is the one who lives with the client. Once again, that is a personal claim of the mother. We said a while back, this has to be supported by legal documentation outlining the parental rights in terms of providing consent and access to a minor's medical record. So the nurse should, is it 1, tell the client's father that the medical information record is confidential and cannot be provided to him. 2, tell the client's mother to settle the issue with the client's father. 3, ask the client's father and mother to write a joint letter of request. And 4, obtain documentation of authority to consent from both the client's mother and father, and from possibly consider all of this initially when you're answering this type of case to be a possible scenario. So which among these four now is the best course of action for the nurse who is knowledgeable about processes and procedures related to informed consent of a minor whose parents are divorced? So if the parents are not divorced, it's entirely a different story. Once again, if we recall our functional concept, one parent who accompanied the child, if the parents are not divorced, can provide the consent even without the consent of the other parent. However, here in this case, you have a 10-year-old child whose parents are divorced. The father is requesting access to the medical records, and the mother is claiming that since she's the one who lives with the minor, then, okay, she gave an order to the healthcare personnel that the records or the access to the child's medical record should only be made by her. So once again, given that you have a divorced parent who could potentially have agreed on specific terms and conditions related to this, the best course of action is to obtain documentation of authority to consent from the client's mother and father, such that you will have a general overview of which among the parents of the minor is legally able to provide the consent and decide on the access for the client's medical records. So the answer is number 4. Obtain documentation of authority to consent from both the client's mother and father. So that's another learning and teaching session with your fact check buddy. And let me share with you our hundreds of thousands of passers from more than 30 countries around the world who are utilizing the Ray Gapos system. And join us if you want to be one of them. So how to study for the test. First, you have to learn how to navigate technology. Remember that the next generation NCLEX RN integrates the use of technology. Second, you have to have the right learning tools. And here at the Ray Gapos system, we provide you with the kind of tools that you need for your test, including our very famous course shells, which you can open anytime, anywhere. It has everything from videos to sample exams, short quizzes, handouts. You can download it, use it on your phone, and it's very reasonably priced. And the third requirement, if you want to pass NGN, you have to be in a conducive learning environment that should keep your focus. So here at the Ray Gapos system, we have our own NGN simulation, plus our classes are limited to a comfortable size. So once again, here's one of our scholars from Davao City, Rogelio Rafael Dahao, and he says one of the best review centers when it comes to NLE and NCLEX. I've been using the review material since NLE days way back 2006. Their teaching strategies and lectures greatly helps in my board exams, both NLE and NCLEX. Highly recommended review for those who are aspiring future RNs. God bless and more power to the RA Gapos review team. And that's coming from Sir Rogelio Rafael Luspo Dahao from Ateneo de Davao University, who passed the Next Generation NCLEX RN for the Northern Mariana Islands Board of Nursing last April 25, 2024. And with that, may I invite you to join us with our Next Generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Our fee starts at $3,499. You can choose to do morning test prep classes during weekdays or whole day test prep classes during weekends, and you can have short test prep classes at night. So your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, and all instructions are usually done in English. And plus, we'll be giving you our QBank access, plus our 3 books, our NGN strategies and sample questions by Dr. Ray Gapos, plus our quick fix session. Okay? So, once again, this is your mentor, your fact check buddy, Ray Gapus, at your service. See you in our next learning and teaching session. Take care.